All right, good evening, everyone, and welcome. My name is Erin. I'm a registered dietitian and certified diabetes care and education specialist. I want to thank everyone for joining this evening and being part of our diabetes care program wellness group. We're really glad to have you. Today, I have the pleasure of introducing Dr. Nancy Shin. She's a clinical pharmacist and certified diabetes care and education specialist. She's been with Stanford Healthcare and our diabetes education program for 8 years. She works in our primary care clinics, helping patients manage their medications and live their best with diabetes. Tonight, she'll be presenting on a really helpful and informative topic, exploring useful diabetes apps. If you have questions, please add them to the Q&A section located at the bottom of your screen. And Dr. Shin will answer the questions throughout the webinar. So this webinar will be recorded and we're going to post it on the Stanford Health Library under the Diabetes Care Program. And there you can also find an archive of our previous webinars. So now I will turn it over to Dr. Nancy Shin.
Thank you, Erin. Good evening, everyone. I appreciate you all joining us and taking the time to learn a little bit more about your diabetes. As Erin mentioned, we'll be talking about different diabetes apps, and I hope we find this presentation useful. So the objectives for today are to understand how technology can help with diabetes management, as well as learn about and share some of our favorite diabetes apps. Now, there's many apps available, and we'll be covering just a few in the realms of apps for lifestyle, glucose monitoring, and tracking your health. Just a little disclaimer, I will not be going over any apps for medication delivery or insulin today, just in interest of time. And these apps are not necessarily endorsed by Stanford. They're just my personal favorites that I'm sharing with everyone today. So I'll start off with just a little bit of background about diabetes technology. So what's an app? Apps are software applications for mobile devices like smartphones and tablets. We've had smartphones around since the beginning of the 2000s, but the apps have been available through self-purchase or self-download through the different app stores. Apple App Store went live in 2008. The Google Play Store went live in 2012. And these are really, by and large, the biggest marketplaces where we can get apps for our mobile devices now. In 2023, 82% of the US population used a smartphone. So this really has, become really part of our daily lives now, this interaction with our phones. American users spend more than 200 billion hours on mobile apps in the last year, and each user downloaded around 45 apps on average. There's constantly new developments of apps. About 20,000 apps are added by the Apple App Store every month. And because, apps have really become part of our daily lives, and that's why I did want to spend some time talking about this, because we really do integrate app use in every section of our lives now, whether it be work, home, health, entertainment, social connections. It's really just become part of our daily existence. Health apps in particular have really been trending and on the rise in the last decade. You can just see kind of the growth of users over the last 9 years. There are currently over 300,000 health-related apps. So that's really quite a bit. Over 1,400 apps specifically that aim to treat diabetes. And 1,400 apps sound still really quite overwhelming to me. Obviously, we've all had experience with apps. Some are a bit more successful than others, or maybe come on and off the market. But that's kind of the number that we're dealing with. So how can an app help with diabetes? When I think about an app for diabetes, I think about this really as part of our diabetes toolkit. When we self-manage diabetes, we have lots of things that are provided to help us improve our time in range, improve our blood sugar control, just kind of improve our reduction of risk with diabetes. So we have tools like for nutrition, exercise and activity, medications, our healthcare team members, self-care tools, mental health tools, and technology really fits in with this very comprehensive toolkit. There were some studies done to show that diabetes apps can also really help with self-care behavior in both the type 1 and type 2 diabetes population. Again, so just thinking about how apps fit into all of this, I just want you to kind of keep an open mind that it's a tool. It's really just a kind of an optional tool that we have to improve our diabetes care. The Regenstrief Institute did a survey among patients with diabetes, looking at what people actually want out of their diabetes apps. And I think the summary is really quite nice, and makes really a lot of sense. What we want from our apps are things that are going to be efficient and easy, things that require minimal effort on our part. If it's a health-related app, sometimes the medical terminology can be kind of hard to digest. So we want things that are really patient-friendly, easy to use and understand. We'll talk a little bit about blood glucose data and how that can be available through apps too, and really wanting to see easy to understand reports that we get out of those apps. By having a really helpful and easy to use app, what this hopefully will lead to is improved autonomy, so helping us to each take care of our diabetes in our own ways. We want this to help lead to behavioral changes or planned behavioral changes, thinking about goals or lifestyle choices that may be impacted by what we get through our apps. And then finally, just better or enhanced connectivity with our clinicians or care team. I'm just going to pause real quick before we go into some examples here. But I'd like to know from the audience, what type of diabetes or healthcare app do you currently use or may have on your phone? And please feel free to enter those into the chat box. Great. So I'm seeing a few responses here. Somebody said none. That was just fine. My Sugar, Quinn, Apple Health, Fitbit, definitely. Dexcom. Okay, great. Yeah, those are all One Touch. Oh, perfect. Yeah, actually, we will be covering some of these in here. So great to see there's some use. Diabetes Pilot, I think Gluco, Clarity, which is Dexcom, My Sugar. Excellent. Okay, great. Glad to see we have some users. And for those of you that are not using apps, that's totally fine. That's partially the purpose of this presentation today. So hopefully this will give you some ideas.
And Nancy, we had one entry into the Q&A, Apple iHealth.
Okay, thank you. My Fitness, Live On Go, excellent. Great, thank you everybody for sharing that. And I don't know if there's a way to actually speak through this webinar, but if anyone particularly loves their app and does want to share information, feel free to also enter that into the chat. Okay, we're going to start off with apps for lifestyle. So lifestyle apps, I think of these that are really apps to help support our lifestyle goals. So if any of you have taken our diabetes classes before, you know, we talk a lot about SMART goals and ways to kind of change our behaviors during the day to really help with our diabetes management. So these tend to revolve around things like nutrition, weight management, exercise, stress management, or mental health care. And really kind of addressing some of these things will ultimately help us, you know, become better aware of our habits and how those impact our health goals. So for example, tracking food can help bring awareness to what you're eating and maybe seeing how that can impact your blood sugar levels. It can help you lose weight or gain weight, whatever your particular goals are. Can help identify where improvements can be made in your blood sugars or intake. And as I mentioned, associate trends with blood sugars. The first lifestyle app I just wanted to cover is Calorie King. Calorie King is also a website that you can access for free. It's really just kind of, I think of it like a food encyclopedia. So you're able to look up foods and break down their contents and calories, carbs, you know, fat, sodium, things like that. It's a very comprehensive database. It's just, you know, you type in the food item and it often gives you different choices in terms of how the foods are prepared. The US version includes 260 different fast food chains and restaurants. So you can look up foods from, you know, certain restaurants as well. I think Calorie King is really most useful for foods that don't come with a nutrition label on it, or just there's no information, like an apple, for example. So kind of like your basic whole foods or produce, you can look up the content of that there. Calorie King is free. If you'd like to pay $12 to remove the advertisements, that's an option as well. I think it's a really great, just kind of basic tool. I would just say, you know, kind of cons for this one is that the database for food is a little bit more ethnically limited. So sometimes may not include foods from other countries. Figwe is another kind of food encyclopedia, but it gives you an option to track your food. What's really unique about Figwe and kind of how they market themselves is that it's a visual calorie counter. So similar to Calorie King, you can look up a food item, but the nice thing about Figwe is that you can self-adjust the portion size. So, you know, for example, if you look up green grapes, it gives you an idea of what these grapes look like. But if you think, oh, I'm actually eating a lot more than that, you can adjust the portion size to kind of match, you know, what your actual intake may be. And then it recalculates all the you know, the breakdown of your calories and carbs based on that particular portion size. You search it by generic food title, and I would say the database is pretty generic, and I think that's on purpose. But again, it's nice because it's one of the very few, if only, visual databases that you can find. It is a free app. And there's a diary as well where you can kind of track your food intake with this app. But there is a premium service cost of $8 a month if you want a little bit more of enhanced products that it can offer, and also to remove the ads.
So Nancy, we have a question wondering, are both of these tracking calories or just providing the nutritional information in the database?
Figwe is a tracker. You can kind of enter in your tracking goals and it will track for you. Calorie King is just a database. There's no tracking for that. Great question. Next is MyFitnessPal. I think somebody mentioned they were using MyFitnessPal. I think of this one really as kind of your like really big all-in-one tracker. This one's been around really for a long time. I think it's quite popular. MyFitnessPal has the ability to track your food, water, exercise, all your calories. It's a very comprehensive tracker, and there's just some screenshots here of kind of what that looks like. I like that you can set goals, and it really does a lot of the work. The free version is, I would say, really has kind of most things that you need, but you can do a premium upgrade of $20 a month to add some additional features like barcode scanning, setting certain types of weight loss plans like intermittent fasting, customizing your macro goals. I think that MyFitnessPal is a really great tool. I will say, though, it does require quite a bit of manual entry, and really a lot of these food trackers do require that. So to kind of get the most out of it, you just have to be prepared to really log everything for it to be as accurate as possible. Control My Weight is kind of another option. It's very similar to MyFitnessPal and the fact that it's this kind of all-in-one tracker. It's actually developed by Calorie King, so it uses the same food database. It's a free app. You can pay $12 to remove the advertisements, but it does kind of the same concept of MyFitnessPal. It probably is just a little bit more basic in design, but some people may prefer that because it may just be easier to go through. And just like the MyFitnessPal too, it does require a lot of just manual entry for logging. There's a couple of exercise apps I just included in here. So exercise apps can be helpful, really. I think if you're already using a different type of exercise tracker, those are great. For example, like a Fitbit or something. These are just really more for direction of how to exercise. Sometimes people need a little bit more encouragement or direction for certain types of exercises, muscle building exercises, and things like that. Skimble's Workout Trainer is kind of a neat one. The basic version is free, but there's lots of different videos and that can vary in length. So if you only have time really to do a 5-minute workout, you can look up a video in that particular length and fit that in. There's a lot of videos that target certain areas or programs and things like that. So that's a really great one. Workouts for older adults is really nice as well. I actually really like the interface of this app. It's very user-friendly, beginner-friendly. It's targeted for older adults. So as you enter in the app, there's a lot of customizable things in terms of age, maybe any health conditions, mobility issues. And then it generates some really kind of nice, easy exercises, chair yoga, things like that. There is an upgrade fee for the premium version of it, but again, I think the basic version has good options too. And lastly, there are mental health apps available. We all know diabetes is a very stressful condition to live with. There is a lot of app support for management of stress, anxiety, depression, and sleep. A lot of these apps are really focused around meditation or kind of, focused breathing, music or ambient sounds. Calm and Headspace have been around for a long time, and those are probably more heavily advertised. They do have a fee, though. The free versions are pretty limited. So I did include here Insight Timer, which has basically kind of the same offerings, but is a totally free app. All right, moving on to apps for glucose monitoring. So glucose monitoring apps are my personal favorite, just because I think we get so much out of them. Glucometer apps are helpful for tracking blood glucose levels. We can generate some really nice trends and reports from the data that we get. And it's really meant to be an automated way to track your blood sugar levels without having to do a lot of manual work. Some of you may be recording your blood sugar levels through like a diary or a calendar or some kind of written way. But if you can get a glucose meter that syncs directly into an app, it does all that work for you. And you can share that data also with your diabetes care team. Most of these connect from your glucometer to your phone through Bluetooth pairing. So all the numbers should kind of automatically sync without much work. But if you would like to, there's always options to add things manually, like any specific notes or maybe medications you've taken or food, for example. So it can be a very powerful tool for tracking sugars. One of the more common glucometer apps is the One Touch Reveal. One Touch Reveal is compatible with certain One Touch products. The VarioFlex, Vario Reflect, and the Ultra Plus Flex. These are kind of their newer models of glucose meters. The prior kind of basic Vario or Vario IQ, unfortunately, does not sync to this, so it does have to be one of these three. The One Touch Reveal, again, syncs automatically from your glucometer to your phone via Bluetooth. It is 100% free. You can share data with the diabetes care team, and that's usually shared through a clinic code. So there's options for sharing there. These are just some examples of screenshots of what you get through the One Touch Reveal app. So on the very left here is kind of your typical logbook or calendar style, where it will log your blood sugar readings based on the time of day and the date. What I really like here is that how everything is really nicely color coded. So green meaning just a quick visual view of, if your numbers are in target range, or if they're red meaning higher or blue meaning too low. And then this correlates nicely with your time in range. So it will give you averages and percentages of what percent of time that your blood sugars are in target range or below or high. It generates an average glucose level based on a time period. So very customizable in terms of how you want to kind of split the data. As I mentioned, there are options to add notes to your blood sugars too. So let's say you have a glucose that was synced in at 104, but you did some exercise. You can sync some of that data directly. You can manually include food that you've eaten, or just kind of notes to keep track of things too. My Sugar app, looks like a lot of you are using My Sugar, but My Sugar is compatible with the AccuCheck line of meters. So these are the ones listed here. Same thing, they sync glucose data automatically via Bluetooth. There are some kind of additional features with the My Sugar app, just compared to like the One Touch, for example. You can sync like your Google Fit or Apple Health tracker data to this one. There's some additional features like a insulin bolus calculator. You can attach meal photos, generate some reports. Some of these additional features, though, are for the additional paid price for the Pro version. And I should also mention, for kind of data sharing, a lot of these apps do allow data sharing to your providers, but your providers also do have to have those accounts available in order, obviously, to receive that data.
Nancy, we have some good questions about, do you need a prescription from your doctor for these glucose meters, or are there some that are available over the counter?
Every glucose meter is available over the counter. You can purchase that on your own. The only kind of benefit you get from asking your provider to order it for you through a prescription is that if you have diabetes, your insurance will likely cover a portion of the costs for the supplies that go with the meter. So, for those of you that use a meter, the test strips can, they can be quite pricey over the counter. But if you have a prescription for it and process it through your insurance, the cost of the testing supplies, like ongoing supplies, will be reduced. But if you just want to purchase one, you definitely could. Good question. Okay.
And someone's asking if My Sugar, do they have a bolus calculator now?
That's what they say. It says the Pro version. Yeah, it says the Pro version has the bolus calculator. I actually don't have this particular app on my phone. I'm not totally sure. but yeah, it's listed as a pro feature.
Okay.
Great question. Going to spend a little bit of time talking about continuous glucose monitors because these are definitely great apps to use. For those of you that may not know, a continuous glucose monitor is a sensor that you wear on your body that tracks your glucose levels pretty much 24/7 throughout the day. The Freestyle Libre and the Dexcom are kind of the biggest, market holders for CGMs right now. Freestyle Libre products have gone through a lot of changes over the last several years, so there's many models available on the market. All the ones that are not the three do require scanning, and so some of the prior models and actually currently can get a reader to kind of scan your sensor. But you can also get an app on your phone for free that does the reading for you. So there's the current ones on the market are the Freestyle Libre 3, the Libre 2, and the Libre 14-day. So the 14-day and the 2 do require scanning, whereas the 3 does not require any scanning. But all of them do have apps that you can get to receive the glucose data. And I actually, personally, as a clinician, I prefer the app over the reader just because that does seamlessly connect the data into the cloud as well, and so that your providers have access to that data at any time. Depending on the Libre model you use, you do have to get the correct corresponding app for it. So if you have the 2 and you're switching to a 3, you do need to download the 3. However, your account with Libre stays the same. So if you just log in with your existing Libre account information, all your prior data should save. There is also the Libre Link Up app, and this is really for family members or anybody else that might be interested in following your glucose data. But if they get the Libre Link Up app, there's a way for them to see your data from your Libre app as well. There's a question. I see the question, is Freestyle Libre painful to use? So these are pretty painless. There is a applicator that you use to apply the sensor to your arm. And, there is a needle that does insert. There's a small filament that's attached to the sensor that will stay in the arm. The filament is like I think of it like a fishing wire. It's just a very small, flexible piece. There is a needle that inserts it in, but I don't really think you feel it. I help patients attach a sensor all the time, and pretty much everyone says it doesn't feel like anything. So it should be painless. And that should go with all the CGMs too. Some Libre features. So as I mentioned, the data reports can be generated from all your glucose readings. So these are, again, just some screenshots here. With continuous glucose monitors, kind of the nice feature is that you not only get the glucose number at the time, but there's also a trend arrow. So it will show you what direction your blood sugars are heading. And then also at any time, you can see this kind of nice graph of your blood sugar trends over the last 8 hours in this one screenshot. All the apps also come with alarm features, so you can set alarms for low sugar or high sugar. Those are all customizable. And then you do generate some nice reports that you can share with your providers. You can also access these reports on the LibreView website. So in case some of you are just looking at your Libre reports on your phone, that's great, but you can also kind of see slightly different views and, kind of just a bigger screen of your reports if you log into LibreView with your existing Libre account information. So you all will see this average glucose profile, which includes like your time and target range, kind of your glucose trends, among other things here. As I mentioned, you can share this data with your diabetes care team. To sync your data, you do need your provider's practice ID. The Dexcom G6 and the Dexcom G7 also have really nice apps similar to the Libre. The G7 just came out last year, so some of you may be using one product or the other. The Dexcom G6 had been around for several years. It's one that it's a sensor we apply on the abdomen, whereas the G7 has been approved for use on the arm. The G7 is a nicer model. If some of you are still using the G6, the G7 does not require a transmitter. The sensor size is also a little bit smaller as well. There's no scanning involved with the Dexcom products. It purely is just just straight data transmission from your sensor into your receiving device. So again, you can get a receiver for it, but really, the phone app does just as fine. You get the app for free, and it can also sync with like an Apple Watch, for example, to see your blood sugars there as well. So also depending on which product you have, you do have to download the corresponding app. So G6 versus G7. The Dexcom Clarity app is the reporting app that generates all the reports and can share with your providers. If you are using the Dexcom G7, you will notice that there are some Clarity reports embedded now into the G7 app at the very bottom. But to share data with your providers, you do still need the Clarity app too. There's also a Dexcom Follow app, which is the app that you can share with family members. So if you want somebody else also tracking your glucose data, they can get the Dexcom Follow app and you can share data that way. The Dexcom features on their app also provide very similar information as what you would get on your Libre. So again, you get that blood glucose level as well as the trend arrow. It gives you kind of this graph in relationship to your target range. And here's that little Clarity pop-up, as I mentioned from before. I should also mention for both of these apps, you can also manually enter information too. So if you want to kind of make notes, so my blood sugar was 110 here, I'm going to add, some information. Maybe I, just came back from a walk or something. You can add those manual notes in there as well. The Clarity reports also include your average glucose profile, time and range, a nice breakdown of kind of your daily patterns and things like that as well. You can also access your Clarity reports through their website, so clarity.dexcom.com. And same thing, you just log in with your Dexcom account information and you should be able to access all of this information. To share data with your diabetes care team, Dexcom recently just went through a change in this process. So previously you may have gotten like a share code or generate a share code to share with your providers. But now they've changed that to a clinic share code. So the process is a little bit different. It's probably a little bit easier to share data, but just for your awareness, that did change recently. I'm just looking through the chat here. I don't know, any questions, Erin? Okay.
No questions. Okay. Some discussion on cost, if your insurance doesn't cover it. And then I just answered in a question about the Dexcom insertion. Is it similar to the Freestyle Libre?
Yeah, very similar, especially with the G7. It's very similar to the Freestyle Libre products now. I see there was also a comment about CGM's available OTC. So the FDA just approved last week, I believe. Dexcom has a new OTC CGM called the Stelo, S-T-E-L-O. I'm not sure exactly when that's going to hit the market yet, but it has recently been FDA approved. I believe it's like a 15-day wear for the sensor. I think the cost is going to be similar to what we see with our Freestyle products, but that is coming soon. Okay, and then I just have a couple of slides here on these kind of all-in-one glucose tracker apps. I don't know if anyone's already using the Glucose Buddy. This one seems to be fairly popular. I call this an all-in-one because it really is a place to put everything all together. It will log blood sugar, medication, food intake, your weight, your fitness data. So it really is kind of an all-in-one combo here. There are some meters that it will sync with directly, particularly the Contour Next One. It also syncs with Dexcom CGM. They also make their own line of glucometer called the Glucose Buddy meter. So all of those can kind of seamlessly integrate your glucose data into this app. It will also sync your activity data with your Apple Health or Google Fit app. And then there are some like optional plans if you want like additional diabetes coaching support, report generation and things like that. So if you are very motivated to track everything, I think this is like a really great tool. Really kind of gives you the most information and all in one place. But it does really require, quite a bit of manual attention and input of all these things that you want to include. There is a free version, and there's, again, if you would like to use the Glucose Buddy meter, there's additional supply costs for that too. Similar to Glucose Buddy is Under My Fork. Under My Fork, I thought was a really interesting concept because it also ties together your glucose and your blood glucose information, specifically with your food intake. So what's really unique about this one is it's a photo-based food logger. So you take a picture of your food that you're eating. If you have a Dexcom CGM, it's really great because you can integrate your actual glucose trends into this app and kind of sync up with what your food was at that time. So there's just, an example here, right? At this particular time, they had this meal. You can manually input like how much insulin you used or any medications or just kind of any other notes there. If you're not on CGM, you can also just do this and pair it with like manual blood sugar data that you input. What's also kind of unique about this is that once you kind of have all this information in there, you can then go back and see kind of which foods impacted your post-meal blood sugars in what way. So it calculates a time and range and associates the meals that kept you most in your target range and those that were maybe caused you to go below or above your target range. So really kind of a great way to answer the question of like, oh, what did I eat to make my blood sugar, do this? So it's a really kind of neat feature for this one. All right, and then just to kind of end here with a couple of other just general health apps. I just wanted to put in a plug for the Medical ID app. If you are an Apple user, Medical ID already comes pre-installed on your phone. Also, if you're an Apple user, you may not be aware that you have an Apple Health app that's already pre-installed on your phone as well. So Apple Health tracks lots of things like your steps, and if you have other kind of syncable devices like a blood pressure cuff or things like that, all of that kind of hubs into Apple Health. But Medical ID is a place where you can store your medical information, any health conditions or allergies, emergency contacts. So just in case you were, found unresponsive or in an accident, it's really for first responders to access, so they know a little bit about you if they're trying to help you. So Medical ID comes pre-installed on the Apple phones, but Android phones do not have this, and so there is a Medical ID app that you can get that basically does the same thing. And these are accessible through your lock screen of your phone. So it's not like somebody has to actually go into your phone to get this data, but there is a way to just access that health information while your phone is locked. And lastly, we do have Stanford My Health. If you guys are Stanford patients, if you already are not using the My Health app, it really is a great one to access a lot of your healthcare. So Stanford My Health includes information about your appointments, labs, your health summary, medication list. There's features to communicate or send messages to your healthcare team. And I just wanted to put in a plug here in case you weren't aware, there is also a feature to track my health through your Stanford Health app. Track My Health is a kind of a hub for you to share your health data, and that will automatically get connected into your Stanford chart. So for example, you can enter information like your blood sugars, your blood pressure, your weight, steps, oxygen, saturation, things like that. If you already have a Withings device, so Withings makes like blood pressure cuffs and scales that can sync automatically directly into this Stanford My Health app. If not, Stanford My Health will then basically sync data through your Apple Health Kit or your Google Fit Kit as well. If you don't have access to that or not quite sure how that all works, you can also do it by manual entry. So you can also just log in information as you want without it automatically syncing. If you don't want to do this on your phone, or if you use My Health on your computer and you're more comfortable with that, you can also enter in manual entry through the website as well. The one thing is, though, you do need a provider to put an order in for you. So there has to be some kind of activation on the provider end. So if you're a Stanford patient and are interested in this feature, you can talk to your Stanford provider and see if they can order this for you. Okay. So that's really to kind of sum it all up. There's an app for everything. We live in a very app-driven society now. So really thinking about apps as part of your diabetes toolkit to help improve your diabetes management. As we've already seen, apps can help with self-care behaviors, setting goals, glucose monitoring, connecting with healthcare providers. Most apps or lifestyle apps have a free version that you can trial, and then you can decide if you want to kind of go up from there. A lot of them do require some interaction. So some do require more manual inputs or interaction than others. But really, the more you engage with your app, the more you will get out of it. So if this is something that's really interesting to you and think will help motivate you, start with one that really fits with your personal goals, whether it be maybe tracking blood sugars or trying to lose weight or, track your food intake. So just find one that you think will work best for you and then go from there. And then the nice thing about apps is that we can always just trial them and then get rid of them if we don't like them or we don't find them useful. So really just try to experiment around. And hopefully some of these were helpful for everyone. But I'll take other questions at this time.
Thank you so much, Nancy. I think we had a lot of great questions along the way.
Yeah, I can see that. I'm going to scan through here.
I did put the link where this recorded webinar can be accessed. It should be uploaded next week.
Great. If there's no other questions, that's the end of my presentation. Thank you everyone for your time and your attention, and have a great evening.
Yes. Thank you all so much for attending, and just a big thank you to Nancy. That was a really engaging and super informative talk, and I learned a lot about apps. So Yep, so this will be recorded and archived and available to watch anytime. And please join us next month. This series is offered every Thursday, the second Thursday of each month. So our next one is April 11th at 5 p.m. And the topic is going to be on diabetes and gut health. And that will be led by our dietitian and diabetes educator, Elaine Hahn. All right. Good night, everyone. Thank you so much.